Alright, in this video, this is something you might want to share with anyone that you know concerning what's the story with this pandemic. All the rhetoric about, the fatality rate, locking down this country and the world by the WHO, World Health Organization, who's run by Adhanom, Tedros Adhanom. And he's not even a physician. He's not a physician. He was at the forefront of this. I'm sure you've heard the name, and WHO being directly involved in all of this, and CDC. Now, what this is about is, the other day, the CDC came out with a graph, information, a scenario, and this is what needs to be shared and told, and everyone needs to hear this. Again, the WHO originally was causing everyone to fear that what this was going to cause, specifically in the United States here, 3.5% fatality rate. Now, CDC just came out with a report of 0.004. That's right, 0.004. That's a long, long way from 3.5%. And I have this article from rt.com. I guess I'll just read this first and then say whatever else I want to say, because again, this is right from the CDC. They put this out about a day or two ago. This article is 26th of May 2020, and the name of it is, again, from rt.com. I'm not endorsing or recommending anything. I'm just merely reading this. It says CDC quietly downgraded COVID-19 death rate, and media ignored good news. Elon Musk wonders why. Now let's leave Elon Musk out of this, but that he was mentioned here. Anyhow, I'll leave the link, but it shows a picture here. It says New York Governor Andrew Cuomo shown ringing the opening bell at the New York Stock Exchange May 26, 2020, has been praised by media despite having the greatest COVID-19 death toll in the U.S. New York Governor's Office, Don Pollard, via Reuters. Here we go. It says, the latest estimates show that COVID-19 is nowhere near as lethal as early models claimed. Yet the mainstream media have been mum on the subject, prompting some prominent lockdown critics to ask why that might be the case. And according to the, quote, current best estimate scenario laid out by the U.S. Centers for Disease Control and Prevention, or CDC, the overall case fatality rate, or CFR, is significantly lower than 3.4% that the World Health Organization, or WHO, claimed early on, and the figure used to justify draconian lockdowns across much of the globe. The CDC also currently estimates that 35% of all COVID-19 infections may be asymptomatic. Then there's a chart here. You could look at it yourself, but at the bottom, it's circled in red, and it says overall. What their conclusion is that the overall CFR case fatality rate is 0.004, nowhere near 3.5. That's a big, huge difference. I'm pausing here to mention this because on this chart, it gives age-wise, 0 to 49 years, 0.0005. Is that right? Yeah, 0.0005. I just noticed that. Now, age 50 to 64 is 0.002, and age 65 and over is 0.013. Now, let me take a look at that for a second. Yeah, 0.0005. I can't even calculate that, but anyway, the overall majority is way in favor of those 50 and over, and particularly 65 and over is the main group there. Now, what does that tell you? I'm going to read the rest of this, but these are people at risk. Obviously, the elderly had pre-existing conditions, and not only that, but wait till you hear what was done with those who were symptomatic and where they were sent. Well, they were sent to nursing homes, and I'll read that, believe it or not. And here we go. It says, the revelation should have been major news, but has gone largely unnoticed. Blaze columnist Daniel Horowitz pointed out on Monday, quote, we destroyed our entire country and suspended democracy, all for a lie. And these people perpetrated the unscientific degree of panic. Will they ever admit the grave consequences of their error? And again, I don't know if I mentioned first that the head, the general, whatever his term is, Director General of the World Health Organization, Tedros Adhanom, and he has a long last name, I'm not going to pronounce it, but he's not even a physician, okay? He's not even a physician. And there's things involved with him that are very, very, I don't know what the word is. He has a long history, let's put it that way, of being involved things and leading things in major, I don't want to say against humanity, just leave it there. Now it says, again he says, will they ever admit the grave consequences of their error? So here we are, and the answer by Elon Musk was, good question, okay? That's how he answered. It says, wrote Elon Musk, the tech mogul behind Tesla and SpaceX, sharing Horowitz's opinion piece on Tuesday. Now, it says, among the points Horowitz makes in his commentary is that the overall CFR, or case fatality rate, again, is actually pulled up by all the deaths in the U.S. nursing homes. So it's you know, the statistics are skewed and off because of this, because of what's going on with the deaths that occurred in the nursing homes, okay? It's made to look like an overall thing, you know, terrible, terrible situation, when that's where the bulk of the story is, and that's where, well, let me finish reading it. So, his commentary is that the overall CFR is actually pulled up by all the deaths in U.S. nursing homes, which a number of governors ordered. Listen to this. That's why I'm pausing here. I'm sorry I'm chopping this up, but it says, which a number of governors ordered to house COVID-19 patients, thus spreading the infection to the most vulnerable population. I have to go over this again. I'm sorry. Let me read it again because it's so important. Among the points Horowitz makes in his commentary is that the overall CFR is actually pulled up by all the deaths in the U.S. nursing homes, which a number of governors ordered to house COVID-19 patients, thus spreading the infection to the most vulnerable population. I mean, if that's accurate, I'm just reading this. I'm not confirming this, but if that's true, I mean, this is insane. And this is the quote. An astounding 62% of all COVID or COVID-19 deaths were in the 6 states confirmed to have done this, even though they only comprise or compose 18% of the national population, he wrote. So, again, 62% of all the deaths from COVID-19 were only in 6 states. And those were the ones who confirmed to have done this. Done what? They sent the positive patients to nursing homes, okay? I mean, I'm just reading this. If this is true, then, I mean, come on, this is insane. If this is actual truth, I didn't, try to verify this, but this is what's being said in this article. So just leave it at that. Again, we're only 18% of the national population. They compose only 18% of the national population. Horowitz claims that the actual death rate for the general population of all ages and health conditions outside of nursing homes is closer to 1 in 1,000, as he blasts both the public policy response to the disease and the media coverage of it. It is not surprising that Musk has found the essay compelling, and he sheared another article last week blaming fear and groupthink for, quote, unnecessary global lockdowns, and clashed earlier this month with lockdown-happy authorities in California over the reopening of his Tesla plant in Alameda County. U.S. President Donald Trump has resisted declaring a national lockdown, letting governors decide what is best for their individual states. Mainstream media coverage of the lockdowns has been remarkably partisan, blasting Republican governors for reopening their states, quote, too soon or not locking down at all, while praising Democrat governors who impose harsh lockdowns, while ignoring that they ordered COVID-19 patients into nursing homes and account for the largest number of U.S. fatalities. As of Tuesday, the U.S. has registered 1,669,040 positive cases of COVID-19, with 98,246 confirmed deaths, according to data collected by Johns Hopkins University. Almost 40 million Americans have been out of work as a consequence of the lockdowns, which began in mid-March and are still in effect in some parts of the country. And there's other things going on with this Johns Hopkins University, who's in charge of the stats and all this. And I think they're even in charge of research and things with viruses, okay? That's a whole nother story, and I just thought I'd mention that here. And it's not good. It's not good. So, to end this here, again, 98,246 confirmed deaths. All right, what's the average flu season? I think it's less than that, or sometimes it might be more. And considering these, I guess, facts, I'm just assuming if this is true, I'll go back and I'll look and try to read up more information about it, that they were sent, the positive who tested positive were sent to nursing homes. I mean, I don't know. I guess so. I mean, that's what's being stated here. But again, the CDC itself, it's right there. You could see it for yourself. Overall, 0.004%. And, okay, so this is, let me see again here. Blaze columnist Daniel Horowitz. I'm not familiar with that, so we'll see what the story is here. He's the one pointing this out. He made the points here. I'll have to see, verify these facts that are being presented here and stating this about the nursing homes. It's really hard to believe. It's so amazing. I can't even talk. Even if it was 1 in 1,000, I did some quick sort of off the cuff calculations before, but don't take these for word. Like 1 in 1,000 would be 300,000 Americans if you consider 300 million. That's not including, like, I don't know, the young or infants or kids. Just general number I just did. So 300,000 would be 1 in 1,000 of 300 million. So that would mean 300,000 CFRs, or case fatality rates, would be at 1 in 1,000. According to the statistics here, Johns Hopkins says 98,000 confirmed deaths, which is, let's round it off to 100,000. So that would be a third of that. So whatever that is, 1 in 3,000, I don't know. But it's, it's really ridiculous. Whatever it is, it would be thousands per state. I don't know how many thousands would be dead already from this. Considering that's not true, considering the condition of hospitals and the reports and so on, many of them have been empty, even laid off, staff, especially in New York City. I'm just reporting what I have seen and heard from what's been going on, okay? Now, I don't know, it would be like, I don't know how many thousands and thousands per state, and this just has not happened like this. It just has not. It would have been a total, meltdown situation. This has not occurred. And, again, I did some sort of statistics here I wrote down, but I'm not going to, they're all over the, all over the map. But, I think I put down, like, if there was 1.4 million CFRs, then it would be 28,000 per state. Is that right? But 78, that's like a tenth of that, are reported as 98,000 CFRs or deaths have been the actual stated confirmed deaths according to Johns Hopkins University. So, even if it was, like I said, 1 in 1,000, that's what it would be, like 1.4 million would supposedly be dead. So that's 1 in 1,000. So it's got to be much less than that. You see what I'm saying? There was someone I'm going to mention here. His name is Jason Goodman. I don't know if you've ever heard of his channel, Crowdsourcing the Truth. But the name of the channel is Jason Goodman. And then he has a second channel called Crowdsourcing the Truth 2. And he, look at that, my mouse just froze. Hold on a second. I can't do anything. Hold on. All right, The mouse is back. What was I saying? Oh, yeah, I did a video on this, several, mentioning him, and he is in New York, and he was walking the streets of New York like a, interviewing and, doing reporting like a journalist, like an old school journalist, and he was documenting everything right there on camera. And I'm telling you, there was not really nothing going on. You could go to his channel, if I remember to put it on here, and go down to his, whatever you call it, where he, I'm sorry, you know what I'm saying, the different subcategories, and it's, COVID-19, he did like 30 videos and of him walking in New York doing interviews and questioning everyone. And he got pretty hostile, reception, and he saw everything that's going on, which is basically really nothing much at all, nothing compared to what they're reporting on the news and so forth. And again, that justifies reporting like that, like a journalistic old-time journalism right on the streets, and he was asking tough questions, and people were getting upset with him, and so on. Authorities, and really turned the cold shoulder on him, wouldn't answer questions. He was wondering why, there's so many ambulances just sitting vacant, no sirens, nothing, no one saw in hospitals, basically empty, during this time, and so on. Things just didn't add up. And anyway, yeah, that's the story with this. I think there were some more things I was going to mention with regard to this, but I guess that's enough for now. I know I didn't do a very good job because I just threw this together, and I had some pauses and mouse problem here. But I just I just saw this. I wanted to come on and do this, and no, honestly, I didn't confirm what was said here as far as this person, Daniel Horowitz. I know that's not a very good thing to do, and just do a video and come on and say it, but I just can't believe it. It says the number of governors ordered to house COVID-19 patients, nursing homes. I find that so amazing. Actually pretty hard to believe if that's true. So I'm not going to, I'm just reporting on what this article is. Let me put it that way, okay? It's just, it's horrifying. It's evil, okay, is what it is, if that's true. And again, because all these statistics and these doctored statistics, to use a phrase, what about the population statistics, the demographics of the ages? And I just read what it said here. I mean, come on, 0 to 49, I'm still speechless of this, is 0.0005. Is that accurate? I don't know, is that a typo? Because then the other ones, like I say, the age groups are 50 to 64, 0.002%, not 3.5, and then 65 and over is the bulk of it, 0.013. So come on. I mean, these people are going to be susceptible to anything, and the general term, coronavirus and so on. Come on, give me a break. Give us all a break. You can't fool people, really. I mean, you can, but the truth is going to come out like it is here. It's just ridiculous, all right? I mean, the statistics of the actual rates, CFR, again, 98,246 confirmed deaths, Johns Hopkins University. That is not unusual for especially the aged with other conditions and so on. And, the whole thing about doctors getting a lot of money by characterizing it as a death by COVID-19 as opposed to not characterizing it by that and getting way less money and putting people on. I'm not accusing. I'm just saying this is a fact. This is what the fact is about this way of handling patients. That if you put them on a ventilator, you get way, way more money also. And, how many people already had pre-existing lung conditions or whatever. And then there's been claims that putting people on ventilators and forcing their lungs to expand and work actually makes them worse because it's putting too much pressure on the body, on the lungs, when they can't tolerate that, okay? So there's a lot of things with that, and there's been reports that the ventilators, I'm just reporting, I'm not making any claims, the ventilators from China run on 5G technology, and I didn't say anything about that in the last videos and even mention that, but that's what seems what others are saying is a part of this and could very well be a part of this. And I think some or many or most of you know exactly what I'm talking about that could be playing a part in all of this, okay? And I'm going to close by saying I may have sounded like, that I was saying that this is all just one big lie and that nothing was going on. And I just want to say that, like I just said, with the ventilators and with the technology, that I didn't say that in the last video or two when I made that statement. So there's that going on, likely, probably, maybe without a doubt. And there's also, I think most of you know about the strains, and they're unnatural in nature. So apparently they were manufactured, and whatever story there is of how it got out or whatever, and what's true about it and what's false about it, and what the truth is about all of this, it really doesn't matter because the damage has been done. And again, the CDC themselves, I'll repeat it again, 0.004 is the overall CFR. And 0 to 49 age is like so insignificant that it's probably way, way under any kind of normal flu or, mortality rate for any given season or time or statistics. I mean, how do you measure that? I don't even know what that would be. That would be like 1/10. Let's say 1/10. I don't know if I'm accurate when I'm saying 1/10 of 98,000 is like 10,000. So I don't know. I might be totally way off. I'm just throwing numbers around here. Let's say the fatality rate in those between 0 and 49 was 10,000. I think it's probably more in a bad flu season. I don't know. I'm just saying. But again, the statistics of the CDC show that up to 50 years old is negligible. I don't know. Am I reading it correctly, or am I making a false, observation? I don't think so. And again, so the ones who really show up in the statistics here are the aged, and a lot of those analysis or what do you call it? The doctor makes their whatever shows that they could say it was probably due to COVID, but they weren't even tested, but it was sort of assumed. I don't know. Again, I'm not making just saying that as a fact. I'm just saying what what I've heard and what could be, part of this, everything that it might be the truth or truthful about this also, okay? So, what were labeled COVID-19 or whatever when, was accurate testing done, and then others were getting false negatives and false positives, and they're saying that even the tests were tainted with the coronavirus. And what corona, what strain, 19, 20? Now, the big scare, what do you call it? I can't think. In a field, I'm sorry. A straw man in a field. Oh, I feel so stupid. You know what I mean? That is that it's mutating. It's changing form. Okay, Scarecrow. Oh boy. So the Scarecrow or Ghost in the Machine or whatever is that this is mutating or whatever. So it's like, making people think, it's just going to keep mutating. It'll never end. And so, how are they going to take some vaccine and make it effectual with this strain, and if it keeps changing, you know what I'm saying? So all these things are just making people even more frightened and worried. 0.004, that's it. I'm done here. It's not a very professional presentation. Sorry about that, but I'm not here to be necessarily professional, though I could have done this in a better, more smooth type of way. So that's the story. I'll leave the article, and that's it. That's the statistics that just came out, and you could find out information, try to verify this for yourself. I find the whole thing so amazing that I'm stunned, even reading this article and asking myself, are these facts? Are these actual? Or are these true? Is this real? What's being said here? Because if they are, then please share the article. Maybe not this video; it's too long, and no one's going to hear all this. But share the article at least, and show them that right from Johns Hopkins, and they're the ones quoted by everyone in all of this with the WHO as the source, as the expertise, the ones in charge of all the statistics, and looking at all of this and seeing what the statistics are about it. So 98,000, that's not those people died, but I'm not making light of that, but in comparison to what this is supposed to have been, and locking down the whole world and making this now found out to be bogus prediction, and throwing it all about and making everyone fear, doing all this to everyone, the whole world, saying it was supposed to be 3.4% fatality. And then there's other reports that we've seen that, like in Italy or whatever, it was like 11% or 15% or some ridiculous thing, or Spain or what have you, Turkey, I guess, France, and so you got to ask yourself, what was the truth about what was going on there also, and all right, that's it. Thanks for listening. If you have this far, all right, take care, bye now.